Hello, I'm Peter Millett from Vail, Colorado. Today we're going to demonstrate an arthroscopic Bankart repair using the 1.8 millimeter Knotless FiberTak implant system. So we've established our posterior portal, and I'm going to demonstrate the new 5 millimeter percutaneous cannula. I'll put a spinal needle in first, and then this can be placed over a guide wire, so it allows you to place the anchors wherever you want. So this will be a high one here. At this point, I'll have my assistant just hold the scope. We'll pull out the center portion of the needle, feed the little wire down. We'll just make a little nick in the skin here. About 4 to 5 millimeters is usually sufficient. And then this cannula can just go right over it. And you can place this anywhere you need. And the nice thing is that the 1.8 anchors will fit through that. Great, so that's our first portal there. So now we've established our second portal here. This is an 8.25 millimeter cannula. I like to put it just over the subscapularis. Usually you can reach most of the glenoid with this approach. Occasionally, if you need a really low anchor, you can go in percutaneously using this 5 millimeter cannula with the same technique. But in this case, I think we'll be okay with these two cannulas. The more medial this is, the easier it is to pass it around the tissue. The more lateral it is, the easier it is to insert your anchor. So you have to kind of take that into consideration. Then what we'll do is we'll mobilize all the labrum and the capsule here, which we've done. My assistant will just kind of pull back on the arm a little bit, and that helps to visualize that. Sometimes we use a 70-degree scope or this panoscope viewing from the back just to help us see this as well. You want to have it mobilized until you can see the subscapularis fibers underneath it. Now we're going to demonstrate putting our first anchor in. This is the curved guide for the 1.8 millimeter anchor. We'll place it in through our lower cannula here. If you put the obturator in, it just helps to decrease any fluid extravasation. And then once it's in position, ideally we'll get it up on the glenoid face. And then I'll tap it with a mallet just to secure it on the glenoid here. And then we'll come in with the flexible drill. And then usually this bone's kind of soft, but in a young patient, I would cycle the drill 3 to 4 times to make sure you clear all the bone debris out of it. Now we'll come in with our anchor. This is the 1.8 millimeter Knotless FiberTak anchor. And there's a little recess in the drill guide here. And it's important to line the little handle here up with that so that it slides down properly. And then we'll insert it by hand for a few millimeters and then finish it off by tapping it in place. And this just bottoms out on the inserter. I like to just check the prongs, make sure they're intact, and then we'll remove the inserter at that point. And then we can pull back on the anchor and make sure that it seats properly. So now our anchor is inserted. You'll see that there's 3 sutures in this 1.8 millimeter Knotless FiberTak anchor. The repair suture in this case is blue. They come in different colors in this system to help with differentiating suture management. But you want to retrieve the repair suture out through the superior cannula. And then you'll leave the shuttling suture here in place out through the inferior cannula. I try not to touch these sutures very much so that they don't get extra twists in them or get damaged at all. At this point, we'll then come in with a lasso. This is a 25-degree left curved. So what I do is oftentimes I'll just kind of stabilize the tissue with the grasper. And then I'll come in perpendicular to the capsule and pop through and then rotate my hand around until I see it in the defect there, and then retrieve the wire out through the superior cannula. Then at this point, we'll just shuttle this repair suture back through around the capsule and labrum. And you untwist this. Then we'll just retrieve that repair suture out through the capsule and labrum. And again, we try not to twist these at all. So there, that's out. Now, one thing I do is I just kind of milk the suture a little bit to take any longitudinal twists out of it. And then I'll park this over to the one side. And at the same time, I'll take the shuttling suture here, separate that. I always separate it from the cannula out, so I'm not putting twists into it. And then move it back and forth. Some people call it a floss technique. And then we'll take an extra suture at this point. This is a countertraction suture. Shorten the loop here, and then we'll pass our repair suture through the loop, and then fold it. There's a little mark, purple mark right there. Fold it to that point. Now I'm just going to convert the suture. So I'll just do this, kind of start off slowly, make sure the suture is entering the cannula properly, and then just pull it out. That converts it. Grab the end of the repair suture. And then at this point, now I can pull back on this traction suture. It puts tension into the loop, and it makes it go in nice and smoothly and without any twisting. And you can see that. I'm going to back up here so we can see that being delivered into the joint here. So there you can see it. You get it pretty close. So just before we tighten it up finally, what I can do is I can come in with my grasper again and just grasp the soft tissue and pull it up and reduce it like that. Pull it tight. You see you still have this traction suture here. We can remove that at this point. Then we can use that again, use it over and over again for the next ones. And then we'll just do our final tightening here. And we've got a nice shift, and we've got a nice restoration of the capsulolabral junction and a nice bumper in the front of the shoulder. So at this point, you have the option to either cut this suture or you can leave it and then do sequential tensioning. I think if you're going to do sequential tensioning, sometimes taking this out of the cannula can be helpful so you don't get it tangled on the other suture. So let's put a switching stick in, pull the cannula out, and then we can grab this suture, and then we can put the cannula back in. And now we have our suture kind of out of harm's way, and we can put our next anchor in without worrying about getting tangled or twisted. Great, so we've got our first anchor in. Now we're going to place our second anchor. This one's a little bit easier. Usually the lowest one's typically the most challenging. Typically we'll place it about the first one around 5 o'clock, then 4 o'clock, and 3 o'clock or so. Place the guide in place. Tap it up on the face of the glenoid, secure it. Then we'll come in with our flexible drill. And then it's important to pull the drill back beyond that little opening in the insertion sheath, so the bone debris can be removed from the tunnel. And at this point, then we're going to come in with our second 1.8 millimeter Knotless FiberTak. This one has a different color repair suture, so we'll be able to distinguish those. Again, you line up this with the recessed part of the inserter here so that it goes around the curve properly, and then insert it by hand initially for the first few millimeters to get it started, and then tap it in place. Remove the grommet, tap it to disengage it. I'll come in with my retriever. This is a mini Kingfisher retriever. And again, you have your repair suture, and then you have your shuttling suture. So the repair suture in this case is white and light blue, so we'll retrieve that separately out of the superior cannula. And again, now I'll come in with my 25-degree left curved lasso. I hold these sutures tight so I don't damage them at all while I'm inserting this. And I'll just back this wire up. And at this point, I can grab this tissue, kind of pull up on it a little bit so it has good tension. And again, go perpendicular to the capsule and come around, hit the glenoid, and then we'll pop through just below our anchor, and then retrieve the wire out the superior cannula. And then we'll shuttle our repair suture back down through the cannula and then around the capsule and labrum. Okay, so at this point, again, we'll separate these sutures so that they don't get twisted. Just put the repair suture to one side and the shuttling suture to the other side. Strip this a little bit to make sure there's no longitudinal twists in it. Now we'll come in with that countertraction suture. So this goes between those two sutures, between the repair suture and the shuttling suture. Now we'll just convert the anchor. So again, you fold it over. There's a little blue mark right there. That's appropriate. And then at this point, we'll convert it. And now we have this this traction suture again. It makes it a lot smoother, a lot less chance that you're going to get tangled or twisted, and it really just makes the procedure a lot simpler. So at this point, we have our suture almost fully tensioned. I'll come in again and grab the soft tissue, and I can get it right to where I want it to be. And then at this point, I then can remove that traction suture, and then we can get the final tension on our repair stitch here. And we can retension our first one if we want. And so you can get a little bit more tension out of that. So now we've completed putting all our anchors in. This is our lowest one here, our middle one, our second middle one, and our top one. We put 4 anchors in this repair. I usually use 4. Sometimes if it's a really big tear, even 5. You can see how it's restored the capsulabral tissue here. Now what we'll do is retrieve our repair sutures so that we can go ahead and tension them again. We'll pull them all out through the cannula, and then after we tension them, we'll then go ahead and cut each suture. So we'll just start at the bottom here. You can see we can retension that a little bit. We looked at this in the lab recently and showed that you get about an extra millimeter or so when you do this. Because as you can imagine, as you pull each suture up and put each anchor in, it helps to spread the force over the whole construct. So there we've tensioned each one individually. So now they're all tight. So at this point, we'll just cut each one sequentially. Just a little pearl, when you're using the cutter, it's always important to cut it right in the center. You don't want to cut it off to the side like that. You'll get frayed edges. So cut it right in the center. Here's our final repair, 4 anchors for Bankart repair. This is with the 1.8 Knotless FiberTak. Gives a very nice low profile repair. You get multiple points of fixation, minimal bone resection, very strong. You can retension it at the end as well, which I think is a nice advantage. Hope this helps you in the care of your patients. Thanks a lot.